huge because a lot of people just don't know where to go, especially if you're recovering from cancer. So they developed a video. I'll give you a second. This is a truly awesome video. It came out a couple of years ago, so if you want to quickly grab the QR code, that'll take you to the video. And then they're hosting a conference. So I mean, like, think about this. I mean, developed an association, a conference. This is moving forward. And this has been, what, I said 2018, COVID interrupted that, so maybe 4 or 5 years of work, and this is everything they've accomplished. When I was looking at these slides, I felt inspired. That was my Kendall Toole moment. I was like, wow, this is awesome. If only I could have this type of impact, because if any of you know Katie Schmitz, she's a force of nature, and she's going to make it happen. So Liz and I got together a year and a half ago, and we were at a meeting, and we said, well, you know, this is a great idea. That was 2018. We need something to energize EIM now. So we're thinking, why not active aging? And we know some of the data and stats, but I think one of the first ones here, and this is from Paige, she likes to do this, I'm going to actually encourage us to stand. So the question is, I would like everyone to stand if you are aging. So either people aren't aging or they're not listening. Okay. We're almost also take a stretch. Okay, good. Where's my Polish? Come on, Gosia, come on down. Come on down. Stay standing. Stay standing. This has nothing to do with the program. But here's our biggest EIM cheerleader from Poland, right on stage here. Come on, jump up there. All right, stay standing. Here we go. Let's go. Get them excited. We don't know. Okay. Yeah. All right.
Exercise is medicine. Exercise is medicine.
One more time.
One more time. Exercise is medicine.
All right. Remember, I said my goal is to get some inspiration going here. So that young lady gives a lot of inspiration, I think, and we've been doing this for 3 days with her. So, and again, Liz touched on some of these stats, and I do apologize, they are American, but I think this is a global number. And I was just showing my class last week stats on aging, and it was like barely 50 years ago, the average life expectancy was in the 60s, you know, and now globally we're getting closer to 80. And this stat, it blows my mind. 12,000 people a day turning 65, right? 18% of our population is over the age of 65, but that's going to go up to a quarter, 1 in 4 people. And I don't think there's anything wrong with that at all, but I'll get to the next point. So this is again, another slide towards the aging and how many people are 100 years old. And obviously Greece and Asia and a lot of other countries around the world are experiencing the same problem. Here it is. Here's Greece, right? The number of people that are 65 here at the top has gone up 3% over the last decade. And I'm sure this is going to rise even more. We all have this challenge, this opportunity of aging society. But that's not a bad thing. That's a wonderful thing. You know, the knowledge, the expertise, the experience we have, really great things. But what is happening is that people are not aging healthy. And we all know this. So I'm not going to go into this, but we're seeing people become less physically function. I can't go into an airport. Airport is like rush hour traffic now, dodging all the people on carts being driven to and from gates because they can't walk from one gate to the next. And so that's, I think, the problem that's really coming with aging is how do we maintain that physical functionality and prevent a lot of these things on this slide. So that's Liz and I sitting in a Italian restaurant in Boston thinking through this, what can we do? And we said, well, we need to start something. We need to adapt EIM like moving through cancer for older adults and aging. And you know, we're looking at statistics, and we saw some this morning on the state with with children and adolescents. It's just as grim for older adults. So 14% meeting physical activity guidelines for aerobic and muscle strengthening activities, right? I mean, the general population isn't better either, but this is crucial to maintaining that functionality. They're not receiving advice. Very few people are having any advice. I mean, this is a group of people that, you know, on average are taking 5 different types of medications. They're going to their doctors, their regular visits, and they're not getting anything about physical activity. Yet we know that physical activity is the best medicine for physical, mental, and emotional health in any population. So definitely have to do something about that. So not only do we have the good short-term and the long-term benefits of physical activity, but it's a medicine to get us healthier. Okay, good, I got that bug, I'm getting healthier, but now can we stay healthy? And then we love those stories of the individuals that start taking up marathon running at age 70, that become a bodybuilder at age 85. And there's a lot of different spaces along this continuum for people to be active. But I think this is the most important one, right? And we have to bend this aging curve. And we have to prolong our years of healthy life before we get into that disability level. And so people who are active are in that green, follow more of that green trajectory, and more people, though, unfortunately, seem to be falling into that orange trajectory. And that's costing our healthcare system a lot. It's putting a lot of burden on healthcare, the caregivers, their family members, and it's putting a strain on our entire healthcare system. So kind of taking a page through that moving through cancer, we said, okay, let's do something. Let's move. Let's make this happen. And we brought together some of the biggest experts that we knew in ACSM and other organizations. And this is a lengthy process. We had a kickoff meeting that was 8 hours over 2 days. We had monthly 2-hour meetings. And we came up with just a ton of ideas and brainstorming and just some really fantastic conversation. But at the heart of it was always like, let's think through that patient journey as it relates to, you know, the healthcare system, because EIM is promoting physical activity that starts in the healthcare system. So when the patient enters that clinic setting, to the moment we connect them with the physical activity specialist, what are all the different steps that they're going to go through that we have to consider as part of this active aging initiative? So we had so many pages of ideas, information, and we were on, Liz, Paige, and I were on all these calls like, well, how can we get this into something that's practical and useful for the public, a mission, a motive? And we came up with some ideas. Fortunately, ACSM has some fantastic graphic artists, and this is what we came up with. A foundational raising awareness, 3 main goals, and 3 cross-cutting themes, all with the end purpose of getting adults more physically active. So let me talk through each of these really briefly. I'm going to start with raising awareness. And imagine, we just did this last spring. We started in February. We really pushed hard to get done by our annual meeting, which is at the end of May. This is Paige Dennison, our leader. She was up there, gave a fantastic hour-and-a-half speech to, I'd say it was about 400 or 500 people in an auditorium like this. We hosted town halls. We were getting the message out. We'd put a QR code up on the screen. We had 230 people volunteer to get involved with this, so we know that, you know, there's excitement, there's energy. We've hosted calls with our EIM Global Network, so we're really pushing this to get out there. And I would say that overall, we've accomplished the mission of raising awareness. It's ready. We've primed that pump. We're ready to go. So now we're about to move into the actual action stage of it. And I'll talk about the first goal here, and that's integrating physical activity into routine care for older adults. So those are the things like embedding that physical activity assessment and referral into the workflow. So what do we have to do that? Expand those partnerships, standardize physical activity assessment tools. Do we want to, screen physical activity levels the same way for older adults that we would for a 20-year-old? Maybe we need to customize that a little bit. Talked nonstop. We've heard it. Daniel spoke about it yesterday. We have to train physicians, nurses, and other people to be able to have these conversations about physical activity with older adults. And then we have to provide all these people with tools so it's quick and easy and they can have these conversations. So we've already had one quick success. We took our physical activity vital sign, which at its core is asking people, how active are you every day and how many days a week are you active at this level? And we modified that for older adults because we know with older adults, balance training is so essential, and muscle strengthening is also incredibly important. So now our recommendation is that this needs to expand to 4 questions, but it hasn't been validated. So my co-author here, Mariana Wingood, she's now out there validating this tool so we can now push it forward even further and really, really try and get this across the entire country as a screening tool that we have to ask older adults on every visit. So goal 2 here is enhancing collaboration between healthcare and exercise professionals, right? We have this void. Everywhere I speak in the world, we have this gap that here's the healthcare, and it's not that doctors and nurses aren't having these conversations. Like I ask people all the time, oh yeah, my doctor talked about physical activity. Well, what did they say? They said to be more active. Well, what else did they do? Nothing. Because the doctors and nurses are then saying, well, we don't know who. We need that referral network like Moving Through Cancer is trying to do, those 2,400 programs they have. So again, just like Moving Through Cancer, we have to develop that sustainable payment model. Fortunately, our government is coming around to the extreme costs of older adults and the loss of physical function, and we have to help them maintain that. So there is some hope on the horizon, and I think Liz mentioned yesterday that there's a usable case around frailty and falls. So that fits really well with this whole active aging and reducing those. Interdisciplinary teams. Health gets a little more complicated as we get older. So we're working with the physios, the nurses, the geriatricians, getting all these people on board in our partnerships, and then advocating for that policy reimbursement in the healthcare setting. So those are some of the things we're doing with Goal 2, or hope to do. This is all in progress. And then Goal 3 here is expanding access. So we get the healthcare system doing it, we get the policy advocacy going, and now we have to make sure that there's programs in the community setting. If you're interested in older adults and you in this space, Enhanced Fitness, led by, which is something that Paige has helped develop, is a program that's in I'd have to ask her, but 20, 30 countries around the world. It's evidence-based, it's promoted and supported by CDC. I'd highly look at that as a potential something to adapt and bring to Greece. So our strategies here really increasing the availability of those programs, making sure that every community has them, especially communities that have less resources, so that we don't have these disparities in opportunity, and then really empowering older adults with more education and resources. So we have an EIM Older Adults Committee. That committee has been tasked with developing more resources for older adults, and they will. And we're going to pump these out, and EIM Greece is more than welcome to take those tools and translate them into Greece, or you all can create your own. Either way, we have to get more tools and resources out there for older adults and the clinicians. So through all of this, as we are talking through each of the goals, each goal seemed to have a little bit of research, a little bit of policy. There was always education and training. And it was just like, well, you know what? These are cross-cutting. Each of the 3 main goals has research, has education and training, has partnerships at its core. So we said, yeah, these are really like cross-cutting themes, and something we really want to develop across each of the goals and everything we do, because we need greater research to expand the evidence base in older adults and drive those policy changes we've been talking about. We think the training of physical activity, well, first the training, and Liz mentioned this yesterday, the training in medical schools for working with geriatric populations is poor, to say the best. and almost non-existent when you start talking about physical activity and understanding the physical activity needs of older adults. But what I'm really excited about is leveraging partnerships. There's all types of geriatric societies, organizations, government entities. I mean, the U.S., we're chock full of those. And I'm just really excited to start bringing those people to the table, and they all want to partner, and we're already starting those conversations. And I think that is, in the end, is what's really going to drive this. So here's some early wins from developing partnerships. This was really cool. The U.S. Senate was hosting a special committee session on aging, and the person that was asked to talk, and was a sports medicine physician out of Alabama, was asked to talk on physical activity. He called Liz. He knew Liz. Liz has such a great name. Says, "Can you give me some talking points?" And she goes, "Actually, I can, because we're launching active aging." And so not 1 month after we've launched it, it's being mentioned to the U.S. government. And so that was in their transcripts, and they're hearing about active aging. Our journals are running special issues around active aging and this initiative. And then I mentioned the partnerships are there. And these are just, forget about the alphabet soup, but the key is there's people that want to partner because everyone knows this is an issue we have to tackle. So that's it. We want to get to active aging for all older adults. And so as an organization, we're like, wow, ACSM has a lot of resources. Can we, we think this can really serve our members. We have 50,000 members, our certified professionals, all the patients, all those people who are, I keep hitting this, I apologize. All those patients out there that are turning 65 every day, and the communities, and making sure those communities are equipped to handle and maximally support us as we age. So within ACSM, we have, I mentioned the EIM Older Adults Committee. So that's a 20-member committee with people from Sri Lanka, Australia, a couple people from Europe. Really great group. But we also have Strategic Health Initiative on Aging. That's another 40, 50 people. We have special interest groups. So all told, we have over 100 ACSM members that are extremely excited and passionate about aging, not to mention those other 230 people that volunteer to be part of this. So we know we have a critical mass of people that want to do something to move this forward. And then we said, okay, well, let's take 3 years. Moving Through Cancer did to 2029. We're going to take 3 years, so we're halfway through year 1 here. We're going to engage every EIM committee. We have about 150 people across all of our different committees. We're going to be at every conference. So that's why when Tassos was saying, we're going to put on a conference, I said, we need to talk about active aging, because every chance we get, we're going to talk about it. We're going to offer trainings and webinars, have different experts speak on this. We're going to keep the awareness going. Even EIM on campus, like, well, can't EIM on campus for college students? Yeah, college students can go out and engage with the nursing homes and the senior care homes and provide exercise training in those settings and teaching our students how to work with these populations. I think many people in the room know, but my experience is students love to work with children and adolescents, and they're not at all thinking about older adults. And I think that's a huge mistake or a huge opportunity because there's going to be a lot of money and a lot of attention in this area in the future. And then last point here, expansion through the global network. I'm here pleading my case for Greece. Is this something you all are interested in? Maybe consider it as we move forward. So we're leveraging all that expertise to address a critical challenge with great opportunities ahead of us, strengthen the role of healthcare providers and health systems in promoting physical activity, but then making that connection to the community and all the exercise programs, places, and professionals, that clinic-community linkage, with the end goal of increasing that physical function, increasing cognitive well-being, independence, and ensuring older adults stay engaged, active, and healthy lifestyles. So my last section here is, okay, so what would that mean for people in Greece? How do we make that a reality here? So here's some of my just quick jotted thoughts, right? So if you're interested, I would say reach out to Tassos and the team here. Don't waste a moment. Email them tonight, tomorrow morning, say, I want to get involved. How do I, let me do that. Then I'd say, well, get that multidisciplinary group of people together. I'm so impressed that we've had people from the Ministry of Health here, the university leadership, the mayor. Get people involved, get the physios involved, get the cardiac rehab, get everybody involved that can contribute to this. Aging is a hot topic. Everyone is interested in this. Engage the students. You know, people say, I was talking to someone at the beginning of the conference, well, our students aren't really interested. Well, maybe as a whole, but if you take 100 students, I bet you I can find 5 of them that are really excited. And I spoke to one young lady here yesterday, and she's just so excited to get involved. And I'm sure there's many, many more. So look to our students. I think this benefits them, helps their professional development. Partner with those older adult associations, those geriatric medical societies or nursing or whatever's out there. A lot of times they want to get involved with this, but they don't know how. We know how. Bring them in. They give us access to patients, to healthcare systems, host virtual planning meetings, get people talking, start forward with that action, seek out sponsors, and identify political leaders in the space who really are interested. And I've seen it firsthand with moving through cancer, an absolutely amazing advancement, but we're going to do it with active aging, and I hope you all will take up that charge here as well. So through these efforts, you know, let's champion a future where physical activity is fully recognized as a powerful tool for healthy aging, helping older adults stay active longer, engaged, decrease that aging curve, and make sure that they're empowered to be in control of their well-being. So, you know, Paige says, be a role model, be an agent of change. And I hope I've created just a little bit of motivation, Kendall Toole style, for all of you in the audience. Thank you very much.